can the birth control pill actually cause breast cancer? Well, it's certainly possible that there is a slight increase in breast cancer, but we need to put this into perspective. The incidence of breast cancer in very young women is very low. And to put it into comparison with other things that young women are typically doing, you really have to get context for this. So something as simple as drinking alcohol carries a 24% risk in your breast cancer risk. So if you're a light to moderate drinker, your risk of breast cancer is actually higher than what they're seeing in the studies from taking the birth control pill. If you're a heavier drinker, it's as high as 60% higher. So something as simple as teenagers or young women in college drinking heavily on the weekends increases their breast cancer risk more than taking the oral contraceptives do. When you look at recommendations from the societies like the National Cancer Institute and so on, they all say essentially the same thing. Overall, the risk is very low and the benefits far outweigh the risk, but there is actually a slight increase. And finally, are there any other risks we didn't talk about? Of course, there are other risks. If you're a smoker and you are using oral contraceptives and you are over the age of 35, it is contraindicated because the risk of heart attack and stroke is drastically higher. And most importantly, at any age, if you are sedentary, a kind of more of a couch potato lifestyle, you are struggling with a high BMI, or you have risk factors for forming a blood clot, including certain conditions, diseases, cancer, all sorts of different things, you can be at a very significantly increased risk of developing blood clots. Even if you have none of those risk factors, your risk is double. Blood clots can go from your legs up into your lung, and that can do very serious damage, including being fatal.